I'm MALAVAZI, a gynecologist and obstetrician. I was the director of the Parola Baton Hospital, a Brazilian women's health reference center, where I first came into contact with Jett plasma technology, which is an innovative technology based on cell nanoporation, regeneration, increased vascularization and transudation, better lubrication of the vaginal mucosa. This technology is also used for the pelvic floor and the vulva as a whole. I'm currently work at the University Hospital of São Paulo Medicine School. What would be the different forms of Jett plasma for her applications? Very briefly, there are 3 different forms of application. We have the wave probe, or the urogynecologic probe, where we apply it mainly in the subarachnoid region to improve mild and moderate urinary incontinence. This probe, which is also thinner, is very interesting for patients with significant atrophy of the vagina, atrophy caused by hypoestrogenism or other situations, such as radiotherapy. We have also the 20mm probe, which is a spherical probe, very interesting for patients who have a genital vulva. And when we are progressing in the treatment of the atrophies, we then switch to this probe, which is more calibrous. And we have the technologies with the silver tip for application to the external region, to the vulva, and we have the gold tip, which is for fulguration, for cauterizing nevi, lesions caused by condyloma plana, condyloma acuminatum, and also for making dots, for rejuvenating the mucosa and the epithelium of the vulva. We can use silver tips, for example, on patients who have herpes lesions, painful lesions, those ulcers, where we apply the silver tip and then desensitize the nerve endings with immediate results. Jett plasma is an efficient and absolutely safe technology. It's a technology where there's no risk of tissue damage, no risk of muscle damage, no risk of injury to the patient. So for the pelvic floor, for the mucosa, for the integument, it's an extremely simple technology to use, efficient, resolutive, and safe. The great advantage of Jett plasma, when we compare it to laser and light-based technologies, is that Jett plasma doesn't hurt, it's innocuous, it doesn't hurt, it's safe, it can be used in all situations. We avoid using it in patients with pacemakers because it's a technology that depends on an electrical discharge, and we avoid, of course, doing it in pregnancy because we don't have any studies on pregnancy. But apart from these 2 situations, it's a technology that has no contraindications. There's no way we can do any harm to the patient. It's an absolutely safe and efficient technology. The device is portable, it can be transported to other locations, it can even be taken to the patient's home. At least 50–60% of gynecological patients have some indication for its use, whether it's penetrating disparity, deep disparity, herpetic lesions, micro-ulcers, small scalp lesions such as condylomas, nerves, moles, small folliculitis. So Jett plasma has a wide range of uses, and I invite you, fellow gynecologists, to have contact with Jett plasma technology, which is an innovative technology, so that you can make your own judgment and see how interesting this technology is for our daily lives. Thank you very much, and see you later.